Hi, and welcome to Jefferson County Hospital's Support and Education Group. We're glad you all could make it. We're really privileged tonight to have Lily Wells with us. Lily is a member of our Jefferson County Hospital family whom we all love and adore. Lily is a physical therapist, and we have had her with, how many years have you worked at the hospital now?
1998, that would make it
8.
yeah,
8 years. Lily has been with our physical therapy department 8 years now. And she has just recently, in the last year or so, become a certified lymphedema specialist or therapist. And that's what her topic is tonight, lymphedema. And it's a confusing sounding diagnosis, but a lot of people have it, especially people who've had cancer, had to have chemotherapy, had to have radiation therapy, and just about all of us know somebody who's been going through that. So by your coming tonight, hopefully you'll go home with some information that you'll be able to share with other people that you know and maybe help them also. So without further ado, we're happy to have Lily Wells.
Thank you, Marcia. Good evening, everybody. And my name again is Lily Wells, and I'm a physical therapist here at Jefferson County Hospital. Before I start, I would like to share that I'm really excited to do this lymphedema management or treatment because we've had several calls to the department and say if there is a certified therapist here in Fairfield, and we usually tell them that the closest one will be in Edema. So we're really excited that we have this program here in Jefferson County. And when I went to class last year, it was a year ago, or less than a year ago, it was 2005, I thought, I really want to do this. I thought that if I'll be able to help somebody that had lymphedema and see the results, then it's just one of those rewarding experience. And I would like to say that I already had one patient, and she was just amazed. She admitted, she said, the first time she wasn't a believer, and then now that she was done with therapy, she thought it was a tremendous help because she could see the difference. It was her upper extremity that she had lymphedema. I guess I could share a story here, a short story before I start. She had broken bones in 3 areas of her same arm, and she's right-handed. So she fell from the table, and she broke her wrist, her shoulder in 2 areas. So it was significant trauma to her arm. And so when she noticed that she had severe swelling of her upper extremity, then I came in and started her therapy, and that it was tremendous. When I first saw her, I did some measurements, and then after she was done with therapy, it looked almost the same as the other arm. So that was good. I felt better. I mean, I felt good to have seen it myself. So anyway, I was certified through the American Healthcare, and I'm also certified in the Leduc method. Dr. Leduc is from Brussels, Belgium. There are a lot of pioneers of lymphedema, and most of them are from Europe. Nobody from United States yet, so I guess I'll be starting that. It will be my dream. I'll be the one starting it here. But there's one from Australia, Dr. Casely Smith, Dr. Voder from Austria, Dr. Leduc is from Brussels, Belgium. Most of them have the same techniques, but I found out that I've learned that Dr. Leduc has very good comprehensive treatment trying to address everything. So let's start. What is lymphedema? Lymphedema is a chronic swelling in a portion of the body, and usually it's the upper extremity or lower extremity. And it is due to the accumulation of lymph fluid in the tissue spaces as a result of obstruction of the venous or lymphatic vessels or nodes. So the first thing you'll see is the patient or the person will have really big upper extremities, like a balloon, or the leg is just so big, and they have a hard time walking. They have a hard time using this. And as Marcia was saying, that it's very commonly seen among patients who had cancer, I'm thinking I'll be seeing a lot of patients that had breast cancer and they had mastectomy. You probably have heard that, oh, they've taken out the lymph nodes here, and what happens is because you don't have the lymph node there, lymph nodes, or several were taken out, what happens is there's accumulation of fluid in the hand. So before I mention why is it important to treat the lymphedema, I'm going to talk about what is lymphatic system first. The lymphatic system is part of the circulatory system in addition to the veins and arteries, and its main function is it collects the fluid in all parts of the body and returns it to the blood. And then what it also does is it removes impurities like bacteria, cancer cells. It gets rid of that. So it's almost like it's filtering the blood. It's filtering the blood in our body so that you have good flow of the fluid in your body. And also it produces what they call lymphocytes or disease-fighting cells. So just imagine if you have radiation and they take out the lymph nodes in your body. The major lymph nodes in your body are in your neck. Sometimes when you don't feel well, sometimes you feel like it kind of hurts here, or some patients would say, I'm a little bit tender here, and the other areas of major lymph node areas are in your elbow and in your groin area. So I also had one patient who had non-Hodgkin's lymphoma, and they took out some lymph nodes of his groin area. So he had lymphedema on his leg for, he still does have it, but he had radiation for 7 years because he had a setback from it. So, okay. So that is the lymphatic system. So why should it be treated? If left untreated, it creates a stagnant fluid causing your arm to increase in size and the lymph channels to increase in number. So if you would imagine a lymph fluid is very clear, like water, a lymphedema would look like motor oil. That's how thick it is. So it just stays there. So it really needs to be addressed by having a comprehensive treatment. Usually a physical therapist or an occupational therapist would have to, a certified one would have to treat this patient. It also reduces oxygen tension, and of course the oxygen is transported throughout our body, and it also interferes with wound healing. A lot of the patients that have diabetes, we've heard that it impairs the healing of the wound. If you have just a small wound, sometimes it gets bigger and bigger. So if you have lymphedema as well, that could be a problem because you don't have the normal flow. Just imagine that motor oil getting, it just stays there and it's stuck there. There's no normal flow of the nutrients in your blood. Then it can also impair the healing of the wound, and at the same time, it can cause infection. And also, what happens with the tissue or your arm or your skin, it really gets hardened, and if you touch your hand like this, they're soft. But then when you have just that severe swelling on your hand, it becomes hardened. It's almost like it's so hard to drain the fluid. And some patients would say, if you have the edema, would say, sometimes if I raise up my arm or elevate my leg above the heart, that kind of helps drain the fluid. But unfortunately with lymphedema, especially with severe cases, the tissue just gets hard, and it's almost like rock. That's how I don't know if you've seen severe swelling, especially on the lower extremity. It gets hard, and it's almost like rock when you touch it, because it's like you could not even what they call like picking edema, because you could even put pressure in it, but there's no place to put pressure in it because it's just hardened. Okay. What are the types of lymphedema? There are two types of lymphedema, the primary and the secondary. The primary is very rare because it's congenital, and the secondary is more common, and it can occur after surgical removal of the lymph node or other obstructive factors such as radiation therapy or from infection. So I bet all of you have, or everybody here in the room knows who had in the community got cancer, or probably somebody from your family had cancer. And as I've said, breast cancer is very common, where they have mastectomy and radiation, or chemotherapy. So secondary lymphedema is more common. I've seen illustrations or pictures of babies that have lymphedema because they were born with it. It's called primary. They consider that as primary lymphedema. The secondary is more common because just from surgical removal of the lymph node, just a trauma to your lymph node can cause the lymphedema. I even had a patient who had knee replacement, and she complained of, she said, I just have this swelling at the back of my leg, and it was there for more than the 6 weeks. And at that time, I wasn't aware what it was. I thought, oh, it was just, probably edema, or it was just swelling from the surgery. But she was really worried about it. She thought, well, do you think I have a cyst? Or do you think, will it go away? Because it's really bothering me because I can't bend my knee because it's just localized in that area. So after the 6 weeks, after having surgery, usually that could be considered lymphedema because there could be swelling after you had knee replacement, after you had hip replacement. It can be common to have some swelling from the surgery, but then after the 6 weeks, if it's still there, that could be considered lymphedema. Okay. Can it be cured? The good news is, with early intervention and proper treatment, yes, it can be cured. Unfortunately, it is a persistent condition. Once you have the lymphedema, you really have to watch, that you don't, just small things like if you love gardening, you have to wear gloves because sometimes just a small prick on your finger can cause lymphedema because, again, you don't have the normal flow anymore on your hand. Your lymphatic system is not working as it used to after having radiation or chemotherapy. You probably have other lymph nodes that were not taken out, but they're not the same because they have to work harder. So, for example, they took out 5 out of there's several lymph nodes in your axilla, on your armpit, but again, they work harder to be able to retain the normal flow in your blood. And self-management and maintenance of the swelling maintenance of swelling reduction is very important. So that's when I come in. Okay. What do I do? What are the treatments available to the patient? Patients would love me for this because I do massage. I will do massage to them, and it's what we call the manual lymph drainage. It's like, it can be tedious, but then it's almost half hour of mobilizing that fluid. There's a certain way of mobilizing that fluid. Some patients would say, can I just do this? Can I just do this? And then, will that drain the fluid? Yes, it will. But then, the technique that I've learned is, for example, you notice that your hand is swollen. I had a patient who also had arthritis, and she said, I always have swelling in my hands. And can I just massage it? You can, but then I always tell them that you can move the fluid towards your elbow, towards your heart, but then you can reach a block or a wall here, and then you might be able to drain the fluid, but it will just come back. So what I do with the manual lymph drainage is I clear the armpit first, I clear the shoulder first, I clear the forearm, the elbow, and then I could clear the hand. So you're like making pathways or channels for it to be able to drain. So that's manual lymph drainage. And the patients would usually just fall asleep because it feels so good. So, and then the other thing I do is also, that's part of the comprehensive treatment in lymphedema management is using bandages. And it's layer after layer of bandages. And that would compress the fluid so it doesn't come back. As a physical therapist, I would teach exercises. You probably know this because we always tell our patient you need to exercise, exercise, exercise. Because the more you favor it, then they say use it or lose it. The more you favor that arm, the more it will retain the fluid. So use it. What is sequential pumping? It's this big machine, and it's you wear a sleeve, or let's just say on the upper extremity on the arm. You wear a sleeve, and it would compress your arm for, let's just say, 5 seconds, and then it will release for 5 seconds. It will compress for 5 seconds, then will release for 5 seconds, then for half hour or 20 minutes. And that will just help drain the fluid. It's almost like somebody's doing this to your arm. And I've tried one, it's like I almost fell asleep too, because like somebody's just massaging it constantly, and then, it's just allowing the normal flow in your arm. Optional services includes, you can also consult dietitian or the nutritionist or social worker. Those are other services. Okay. Who is a candidate for treatment? As I've said, patients that have cancers, particularly breast cancer, that have lymph node taken out, and they have any swelling on their arm, hand, and chest. I even saw a case where the patient had swelling in her face. Her face was this big, and it's like wondering, how did that happen? You could hardly recognize the person because the face was also swollen. So I can also do lymph drainage of the face. So I bet that would feel good. Also, patients who had swelling due to hereditary, like the primary lymphedema, had trauma like any kind of surgery, like knee replacement or hip replacement, and or radiation. Is all swelling lymphedema? What do you think? Oh, Pete, the answer. I didn't want to show you the answer. The answer is no, because there's different kinds, different causes of swelling. Marsha just asked me yesterday, or I guess you brought it up, that somebody asked her that, what is the difference between edema and lymphedema? You want to answer?
Well, edema usually occurs primarily or first before what we call lymphedema.
Yes.
And it's the immediate or initial reaction to a trauma. If you sprain your ankle, it swells up, and it's a bad-looking puppy for maybe a week, maybe 10 days, maybe a couple of weeks. But that, nature takes care of it, the system works, and that fluid eventually drains out and it goes back to normal. Lymphedema is when that process gets interrupted, the lymph system doesn't work, and therefore the edema, the original initial edema, doesn't go away. And once it's become prolonged and the system breaks down, then it's called lymphedema. So lots of us get swelling, short term, goes away on its own, that's edema by itself. Long term, system involved, that you can't drain it yourself, then it becomes titled lymphedema. So, and we were afraid that everybody seeing lymphedema would not know that there was a difference, and this is good to find out.
That's right. So some patients worry, does that mean that if I have lymphedema, does that mean my cancer has returned? Well, excuse me. When swelling first appears, many people would worry about that, but then we tell the patients that although returning cancer can cause lymphedema, this isn't often the case. And usually we tell our patients that if you notice something different, then you might need to contact your doctor or your physician. Anybody who are taking water pills or diuretics, Lasix? Okay. Would diuretics help? Well, they have little effect on this type of swelling. As I've said, as Marsha was mentioning, that it is something in your lymph system. With diuretics, you go to the restroom, you know, several times a day, and then unfortunately with lymphedema, just imagine that stagnant motor oil there. So it might help, but it's very, very little effect. We tell our patients too that you might want to discuss this with your doctor if it seems like you're taking water pill and the edema or the swelling is not improving. That means there's more problem to your system, which could be your lymphatic system. What are the signs and symptoms of lymphedema? The first thing, of course, is there is increase in size. Your arm is like a balloon. It's so big. And you'll notice it because it's very rarely that it could be both hands or both legs. But you can just compare how swollen the hand is compared to your normal arm or to your good arm. And it can be also localized just in your shoulder and forearm, and you don't have swelling on your hands. Or it could be you can have the swelling on your hands and not have swelling here. It could be different what do you call it, characteristics. There is also like feeling of heat. It's like it's just warm, really warm. Some patients will say sometimes it's burning heat, and it feels like it's gonna burst. It's like, because it's so big, it's that there's just no room for it to go. And some patients would notice that they have fluid coming out of their skin. And puffiness of the limb, and it's tender to touch, especially in the groin area, if or in their abdomen, if they had radiation in the inguinal area or in the groin area. And then same thing with swelling of the thigh. It's not because they have big thighs, it's just it was swollen from lymphedema. What are the safety recommendations? Meticulous skin care. So every day you always make sure you note if there is change in your skin. Because sometimes some patients, especially with diabetic patients, they didn't know that actually they stepped on a nail. You know, they were walking barefoot or they were mowing the lawn and they had, you know, something was stuck there and they didn't know and they had an open wound, or, you know, just to make sure that you know if there's any changes. Prevent infection. If there is, you notice that there is swelling accompanied by drainage or change in color, contact your doctor right away. Avoid fatigue and injury. I like this one. I'd like to have a vacation now. Avoid fatigue, just so that your body's healing process also is allowing you to I guess, to accelerate the healing process. Use sunscreen, part of your skincare, and wear rubber gloves or any protection for your hand, like example, gardening. Avoid tight or constricted clothing or jewelry. Again, exercise. Exercise at least 3 times a week, even just for 20 minutes. It doesn't have to be strenuous exercise. Even just take a walk around the block, and then you can start with just walking, and then eventually you can probably do 2 blocks. See how you could tolerate that. But during the winter, I guess tomorrow we're gonna have snow. Indoor walking might be good. I have a patient she says she goes around Walmart. I said that could be really expensive, walking around Walmart. Eat a well-balanced diet, that's very important. And of course, have a good communication with your doctor if you have any concerns, especially if there is any sign of infection. Okay, that's it. Do you have any questions regarding lymphedema? I have brochures here for all of you, and you could read it when you get home, and you go home, and then I work here every Monday through Fridays anyway. You could call me if you have something pops up and you have questions. Yay, you're good. You don't have questions.
Many